did nothing? Because a lot of people would like to know that.
So thank you. I mean, you all know you've all seen the models. You've seen the models from Imperial. You've seen the models from Columbia. We've reviewed 12 different models. And then we went back to the drawing board over the last week or two and worked from the ground up, utilizing actual reporting of cases. It's the way we built the HIV model, the TB model, the malaria model. And when we finished, the other group that was working in parallel, which we didn't know about, HIME, and Chris Murray, ended up at the same numbers. So if you go on his website, you can see the concern that we had with the growing number of potential fatalities. All of the flu models predicted anywhere between 1.6 and 2.2 million fatalities if we didn't mitigate. I think you all knew those numbers. Some of them predicted half of the United States would get infected and have that level of mortality. So we've worked very hard together to really look at all of the impacts of the different mitigations that have been utilized around the world and use that evidence base to really bring that data and that evidence to the president to consider for extending, which is not a simple situation when you ask people to stay home for another 30 days. And so they have to know that we've really built this on scientific evidence and the potential to save really hundreds of thousands of American lives. And we know that's a huge sacrifice for everyone. We know it's a sacrifice for every mother and child and father who's also self-isolating. There are people that have to go out to work, and we know the compromises that they're making. But it's all to protect not only Americans, but the healthcare providers. The healthcare providers that are on the front lines, and you've seen them, and you've seen how difficult this has been. And so we're really working. There will be a comprehensive piece presented on Tuesday that really talks about not only diagnosing individuals, but also increasing our surveillance now that we have more test kits so that we can really stop and contain new infections. At the same time, we're really dedicating test kits still to the critical diagnosis so people can get the treatment that they want. And so that we can ensure as when people come to the hospital that they know that the nurses and the doctors and the equipment that they need will be there to serve them. Because together as Americans, we're going to bring down the number of infections so we don't have 2.2 million deaths or 1.6 million deaths, but really work very hard to keep this in the lowest numbers we possibly can.